Welcome to Glowtime with Jackie. It isn't about chasing youth, it's about owning your glow, reinventing your story, and showing up like never before. Glowtime starts now.
Hello, beautiful people. Welcome to Glowtime with Jackie. Today I have a special guest, Jumi Adeyinka. Jumi, thank you for being here today.
And thank you for having me, Jackie. It's a
Of
pleasure to be here.
course, of course. Today we're going to speak about something that never gets talked about. So typically we talk about choosing the plastic surgeon, we talk about the results afterwards, but what about the post-operative care? That seems to get lost in the sauce.
Yes.
So always, there's always that extra special massage, lymphatic massage that's highly recommended that we don't talk about that is essential for a great result.
Yes.
So Jumi's here to tell us a little bit about her business, and I'm so excited to have you here because, of course, we've worked together. We
Yes.
met we met probably a couple years ago, maybe 2-3 years ago.
Yes. About 3 years ago, if I believe. Yeah.
Yeah.
About 3 years.
You came to the office and you told us about your services, and I was really fascinated with you, of course.
Oh,
You're
thank you.
stunning. And then, of
Thank you.
course, with your services. So tell me a little bit about you, Jumi.
Yes. So I've been a nurse for the past 13 years. That's how I got started in the post op world. Done a little bit from trauma to wound care to med surge, and then opened Skin Deep Sculpting May of 2020. So during COVID. So we are about to turn 6 soon.
Wow,
Yeah. Thank you.
congratulations.
Thank you. And what we do, we focus on post operative care for patients who've had plastic surgery. And it's amazing.
Yeah, so Jumi, so you say that you just do a little bit of that, but no,
Yes.
you really have a well-oiled machine.
Yes.
Like you really take care of the patient from the very beginning to the very end to the during,
Yes.
because we've had patients go and see you
Mhm.
and basically they're so excited. You even wash their garment while they're literally having a massage
Yes.
done.
Yes.
You guys take their garment, which is to me genius. It's such an
Yes.
excellent concierge touch.
Thank you.
So I feel like you do it all, and you
Yeah.
also will do massages at home.
Yes.
So yeah,
Yeah.
elaborate a little bit about that. And two,
Yes.
tell me what the importance is of getting the massages.
Okay. So we try to be very full service in our approach to post op care. We do everything from taking care of the minute details to the bigger picture. When I started this business, it was just me, right? And, there weren't many post op places open. So I thought about the best comprehensive care for patients because when you're going through surgery, you need very high touch, hands on care. You can't leave anything up to chance. So we take care of patients in our office, in the Heights, and then we also take care of them at home. We start from the very first step after you get surgery. Hey, introduce ourselves, how many massages you're going to need, and talk to them about, the very first day post op to the very, last day. We start about a day after surgery and we walk them through, you know, are you having a tummy tuck, liposuction, and all of those things, and get very hands on when it comes to how you should space out your massages up till like the very minute detail. Like I said, when you're having your massage, we'll take your garment, wash it for you. That's just one less thing you have to worry about because a lot of people getting surgery, they're not really sure what to do after surgery. They're just kind of just flying blind and guessing.
Yes, that
Yeah.
happens a lot. And as
Yeah.
you know, from a doctor's office perspective, as much as we
Mhm.
try to explain to them,
Yeah.
as much as we tell them we have written instructions, we tell
Mhm.
them
Oh,
everything,
yeah.
they still, when they leave the office, they're like, I don't know what to do. I don't know what to do.
Exactly. Yeah.
So it's nice because you're also an extension kind of the office.
Yeah.
And one of the things I loved about your place is that you actually wanted to know what our protocol was.
Yes.
You
Yeah.
wanted to know exactly what it is that, Dr. Bedros does,
Mm.
what it is that he recommends, when
Yes.
should the first treatment be,
Yes.
all those things.
Yeah.
And you know exactly how to handle each patient
Yeah.
based on the doctor's protocol, which I love.
Exactly. Yeah. Because every surgeon's different. Like,
Correct.
even when you're working with surgeons in the same practice,
Hmm.
everyone's approach is different. You can't treat surgeon A as you would surgeon C and F. You have to respect exactly what each practice and each surgeon's protocol is, because that's
Yeah,
their patient,
absolutely.
and we're just an extension of that care. We want to make the surgeon's job easier, and that starts with: how often is your surgeon performing surgery? What are their surgery days? What are their clinic days? What do they want you to do if you spot a seroma, if you spot fibrosis, if a wound, a patient has a infection, dehiscence, separation,
Yeah,
every
all great
little.
things.
Exactly.
All
And you
things.
you can't just guess. That's and we respect professional boundaries a lot, because it gives our surgeons peace of mind knowing, okay, they're not just doing whatever they want, they're actually tailoring my patient's care based on my instructions, and that is so important.
Yes, so
Yeah.
important for us
Mhm.
because we want to make sure, again, that the patient's taken care of.
Mhm.
Again, this is such an important part. And I will say this, like the massage,
Yeah.
lymphatic massages, that wasn't always something that was recommended, that
Yeah.
was done,
Yeah.
even though it was always there.
Yeah.
I will say in Latin American countries, we definitely knew about the massages. We were definitely always
Mhm.
doing the wood therapy
Oh, yeah.
massages,
Yes.
but it really started becoming more and more popular
Yeah.
recently
Yeah.
because I would say, yeah, like 6 years, maybe
Yeah,
7 years.
but like right around COVID, I would say a lot more medical tourism picked up,
Yes.
and
Yep.
people realized, well, I don't have to stay in Houston or Texas or in the US to get surgery. So when they're traveling out, they're coming back with knowledge, and we're starting to adopt that more.
Yes. Yeah. Absolutely.
Yeah.
Absolutely.
Yeah.
And so, yeah, so, the massages is one of those things that I personally did
Mhm.
after I had liposuction,
Mhm.
which is about 10 years ago.
Yeah.
But then I still maintain, like in the summertime, I love to maintain with lymphatic massages
Yeah.
because I
Yeah.
think it makes such a difference. I think it just helps with overall the appearance of your
Yes.
skin, with
Hmm.
overall, just the
Overall results
the
too.
swelling,
Yeah.
cellulite, all that.
Yeah.
I absolutely love it.
Yeah.
So, let alone after surgery, how important it is to have it and really be, at it as see it as an investment,
Maintenance. Yeah. Yeah.
too in the overall procedure
Yeah.
because you just really want to, make that procedure have the best result
Yeah.
possible.
Yeah, the
Yeah.
optimal results. And I tell people, like, getting surgery is like getting surgery and not getting post-op massages. It's kind of like breaking your leg and then you don't do physical therapy. It's
Yeah.
like, how do you expect to walk normally and properly pre accident as you did after? It's therapy. You need it. And people don't realize surgery is very serious,
Yeah.
and your body's going through so much changes, and it's going back to equilibrium. So those post-op massages it shouldn't even be optional. It should be
Yeah.
mandatory. Just get
Absolutely.
them. Yeah.
Absolutely. I totally agree with that. And so, like we talked about earlier, every procedure is a little bit different.
Mhm.
So, with tummy tuck,
Mhm.
and again, every doctor's protocol is
Yes.
different.
Yeah.
Some doctors are allow you to start that day.
Yeah.
Some doctors will say 3 days. Of
Yeah.
course, too, it's always up to the patient if she can tolerate it
Of
because
course. Yeah.
right after surgery, it can be a little bit uncomfortable.
Yeah.
But definitely don't let that be the reason that you don't get them done
Exactly.
because it's going to help you overall in the long run.
Yes, that's
In the
true.
long run, it's going to
Yeah.
help you.
Yeah.
And then, of course, there's liposuction
Mhm.
that you always, I recommend doing that the very next day.
Yeah.
And yeah, if it hurts a little bit, still do it because it's a little different. There's not an incision there. There was no muscle
Exactly.
work. Just
Yeah.
be tough.
Exactly. Tough it out.
Just tough
And
it out and do it.
exactly. And when you prep for the massages before surgery, you're able to mentally prep yourself
Yeah.
and go into it not blind at all. I think that's where most people mess up. They go into it blind and they're terrified. They
Yes.
come into our spa the first day and there's like, you know,
There's
scared
like
little
a deer.
cat.
Yes,
Yeah,
like
yeah. And
Deer
I
in
just want to
headlights. They
hug
don't
them
know.
like it's okay. Like,
Yeah.
and they ask me, does it hurt? And I look at them in the eye and say, yes, it hurts. But we're going to help you get through it. And we have,
Yes.
different techniques to make it less painful,
Yes.
but it is still very necessary. So I'm glad that more people are learning about this.
Yeah.
Mhm.
And two, let's just talk about the BBLs.
Yes.
So that's another thing,
Yes.
another reason that you want to,
Yeah.
again, have the massages
Yes.
because it does help with fibrosis there,
Oh,
correct?
yes. Yes.
And that's another reason, too, I think that we saw, I guess, bringing the BBLs coming on and being
Hmm.
more popular,
Yeah.
that brought on more liposuction.
Yeah.
And therefore, definitely with the fibrosis
Yeah.
and definitely with the shaping, I think we
Exactly.
saw like an influx in the massage therapy for sure.
Definitely, we even have rap songs about it,
We
right?
do. Yes, we do.
But the BBL just that's exploded.
Yeah.
Everyone and their mom and their aunt and their grandma, everyone's getting a BBL. We even have more influx of male BBLs
Yeah, I've seen
now.
that. I know we've done a few
Yeah,
patients.
so nowadays everyone just wants to look their best. There is no stigma that we used to have back in the 90s and early
Yes.
2000s about
Agreed.
surgery. And it's more mainstream thanks to TikTok and
Yes.
Instagram and Reddit, and we are taking control of our own happiness when it comes to how we look physically. And I'm
Yes.
all for it. We're definitely not here to shame anyone for having surgery. I'm more pro make sure that you do your research,
Yes.
do it safely, and be prepared.
Yes,
Yeah.
absolutely. That's always still very
Yeah.
important and always on the
Yeah.
forefront, of course.
Yeah.
Tell us a little bit, we just to talk about what are the benefits of the massages?
Okay. So immediately after, when you're getting a massage and your incision's still open, or you still have like JP drains or Penrose drains after tummy tuck, it pushes all of that fluid that would usually sit within the body. It pushes it out, right? It reduces inflammation. It allows you increased mobility. A lot of people, some of them, we even have to reopen their incision if it's closed immediately after surgery. Some people heal very quickly.
Yes.
And people feel so much better, so much lighter, less swollen,
Yes.
um, better results. So that's one of the huge benefits of the massages, right? Another benefit, and most people don't think about this, having something planned every day after surgery to get up and out of your house reduces the chances of blood clots because you're actually
Yes.
walking,
That's a good
right?
point.
Yeah,
That's a
and
good
it
point.
reduces what we see a lot is post-op depression, where people are just
Yeah.
like at home by themselves in bed, like in the dark, like, oh my
Yes.
God, I feel like I'm in so much pain, everything
Yes.
hurts.
The less they move, the
Exactly.
more sore and stiff you're going to get. Yep.
Exactly. The more worried they are, and then they go into this mental spiral of, oh my gosh, why did I do this?
Yes.
Yeah.
Yes, that
Yeah.
happens.
And just getting out of bed, putting
Yep.
clothes on, even if you show up to the office with your robe and slippers, we don't care.
Yeah.
As long as you come in and you get the massage and we talk to you, we educate you,
You
we do a
hype them
little,
up.
you
You're the hype
know, let
women.
they see their
Yes.
they see photos, they see themselves in the mirror, and we can talk them off the ledge like, oh my gosh, you're not
Yes.
botched, it's literally just a seroma, or just you know it's just bruising, it'll subside. That
Yes.
helps
Yeah, they
a lot.
always need that
Mhm.
extra reassurance.
Exactly,
And
they
this is a
do.
good way for you guys
Yes,
always to help. And
that's a huge
again,
part of the job.
yeah, and again, it's an extension of the practice because
Exactly.
they come see us once a week. They
Yes.
can't see us every day
Yeah,
or, a couple times a week. So it's very
exactly.
helpful for them
And
for
they're seeing
sure.
us every day, and
Yeah.
it helps for sure when it comes to overall recovery. The massages I don't think it's optional. I think it should
Yeah, it
just
should
be
be
mandatory.
mandatory.
Yeah.
Yeah. I always tell my patients, I
Mhm.
always try to tell them from the first visit.
Yeah.
So if you know we're going to do a tummy tuck,
Yes.
liposuction, know that you're also going to, we recommend, I said, they're not obligatory,
Yeah.
but we highly recommend it for the results. So
Yeah.
once you tell them that up front,
Yeah.
then they're always more likely to get the massages. And
Exactly.
again, it's just going to make it so much more helpful.
Exactly. And they could start doing their research and prepping
Yes,
for it as
yes,
well. Yeah.
exactly. What changes do you see from the first appointment to the last?
Ooh, I like that
I know it
question.
varies
Yes.
because, and we always say at least 10
Mhm.
10 massages,
Yes.
minimum 10.
Yeah. Okay. So from the first appointment, they come into the office, they're hunched over. If they have a tummy tuck,
Yes.
they're in so much pain, lower back pain, feeling stiff, lots of swelling. That's for tummy tuck. BBL clients or just lipo clients, you see like they're swollen, they feel constrained in their faja, which is all
Yes.
normal. That's
Yes.
part of it.
Like walk in like Frankenstein.
Yeah, yeah. And I when we have clients walk into the office, I poke a little gentle fun and humor just to get them laughing. I'm like, man, you survived that accident, huh? You look like you got hit by a Mack truck and you survived because that's how people are moving.
Yes.
The first week is tough.
Yeah.
And I tell people there's something about that third massage that really like it really takes people out.
Yes.
And then after week 1 and 2, people start feeling a little bit more like themselves.
They wanna stay
They
longer.
want
They
to
wanna
stay
hang
long.
out.
Yes. And then you hit a part of the massage around like week 2 where it starts feeling better. It still
Yes.
hurts a little, but
Yes.
you're looking forward to it.
Yes.
And then we're progressing to week 3 to 6 when they're switching garments and maybe they're about to get into their stage 2 and they're starting to feel
They feel
themselves.
themselves they see the shrinkage, they
hmm
see how small they're
They come in,
getting.
yeah. All
Yes.
my BBL clients, week 3, they're coming in like the Lululemon,
Ah,
and I'm
yes,
like,
they're feeling
I
themselves.
could see that booty,
Yes. Can't miss that thing.
Exactly. So I love the progression of ouch, oh my God, everything hurts. What have I done to myself to okay, okay, okay,
Yeah.
okay, it's worth it.
Yes, absolutely.
Yeah.
Yeah.
So
No,
that
that's always I love to see the patients when they get that confidence.
yes,
They get
yeah.
their confidence back or
Mhm.
some women didn't have a lot of
To
confidence
begin with,
and
yeah.
this is helping build their
Exactly.
confidence.
Yeah.
Listen, plastic surgery is never about anyone else. It's
For
always about
yourself.
ours.
Yeah.
It's always about
Yeah.
ourselves. It's always about what bothers us. It
Yes.
always
What we
whatever,
see
yeah,
in the mirror.
what
Yeah.
we see and what we want to
Yeah.
correct. And once we get that correction, it's like
Exactly.
amazing. We
It
get
is.
this confidence back and
Yeah.
it's just so good.
Yes.
So I love to see that confidence.
I
I love
love
to
it.
see in their tight fitted clothes someone that maybe
Yes.
never,
Yeah. I love
never.
to see when the husbands look at them or the
Yes.
boyfriend's like, yeah,
Yes.
yeah. And they're like, ooh, yes, this
I love
was
that
worth it.
too.
Yeah.
I love that. Okay, so for women considering surgery,
Mhm.
when should they schedule their post-op care?
Okay, this is a good question. I get this all the time. When people call our office line and like, "Hey, I'm getting surgery tomorrow," I'm like, "Oh, okay. We can help you. We can schedule it out." But typically, you want to do this about a week or two before.
Mhm.
That's when we contact the client. "Hey, your surgery's coming up. We're wishing you luck. Hope everything goes well. Are you prepped? Do you have everything you need? Your shopping list? Is your house prepped for surgery
Mhm.
recovery? Do you have someone to pick you up?" So you want to start thinking about that like a week.
Yes.
Book your post-op massages a week and then book them out every single day for the first 7 days.
Yeah.
Yeah.
That's a good point.
Mhm.
What should they ask you also? So is
Yeah.
there a certification,
Yes.
massaging?
Yes.
Like what is it that they should ask that
Yeah.
makes you say
Sort of.
stand out, of course,
Yeah.
certifiable?
Yeah, so being a nurse and our entire team is full of medical professionals and they're double certified. We have licensed massage therapists, we have medical assistants, we have licensed estheticians. So people do ask like, "Are you guys certified and licensed?" And we say yes. Because and we have a medical director
That's
as well.
awesome.
So God forbid anything happens, which is very rare because we have amazing doctors that are very hands-on as well
Yes.
and our
Mhm.
entire team is hands on. So, being the on call nurse and having an MD in house, we tell them you have nothing to worry about. All you have to do is prep, book everything you need to, and we'll take care of the rest. Yeah.
Wow, that's amazing.
hmm
That's great.
Yeah.
So tell me, what is the biggest recovery mistake that some patients may make? Because I know you see it all.
If you're traveling for
Yes.
surgery, please stay the recommended amount of
Yes.
time
Don't try to
that
come
your
here and
doctor
leave.
don't please don't get a tummy tuck and come home 3 days post-op.
Ugh.
That is stay and recover and take the time needed because traveling, we see that a lot with traveling patients. They come back home and then they're scared their doctor pulls out their drains too early. Now
Yes.
they're dealing with
Yes.
seromas that turns to
Mm-hmm.
fibrosis and we're having to treat all of that. So my number one advice, if your doctor recommends you do something, especially when it comes to staying put before you travel back
Yeah.
home,
Yeah.
do that. That's very important.
Yeah, I second that.
Yeah.
For sure. That's
That's
very important.
yes.
And
Yeah.
that's one of the reasons that we're a little bit hesitant to take a lot of out
Out
of
of town.
towners
Yeah.
for
Yeah.
that reason.
Yeah.
Sometimes, it's like we want to, but we don't want to rush surgery. We
Exactly.
don't want to rush you back home
Yeah.
either.
Yeah.
And a lot of times the outer towners are the ones that they have to
Rush,
get
rush.
back. They
They're on
rush.
a time
They
crunch. Yeah.
rush.
Yeah.
So it's a little bit uncomfortable too. And of course we're always very cautious with that.
Yeah. Yeah.
Okay, so let's see. We're going to do a little rapid fire here.
Oh,
You ready?
okay.
All
I'm
right.
ready.
Most common surgery that you treat?
Tummy tucks.
Tummy tucks. Okay. Biggest post-op myth?
You only need to be in your faja for 3 weeks.
Yes, that's
Or you don't need one.
or
Oh
you don't need
God.
one. You
Yeah.
can take it off after 2
Oh
days.
God. Yeah. Definitely no. No.
One word that describes your mission.
Empowering.
I love that.
Yeah.
Empowering. What does glow mean to you?
To radiate positivity that it just infects other people,
Yeah.
being so confident and happy in who you are. When you walk around in life with that glow, other people, it
Yeah,
radiates,
absolutely.
and that's what surgery and recovery should be about, is just becoming a better version of
Yeah,
yourself. Yeah.
absolutely. We should
Hmm.
always strive that,
Yes.
right?
Yes.
Strive that and help others strive that as well.
Exactly.
And just be,
Yeah, that's a
hype,
good
hype
question.
women,
Yes.
hype women.
Women hyping women
Yes,
hyping men
yes,
hyping women,
yes, of
yeah.
course. Absolutely. All right. Well, Jumi, it's been a
Yes.
pleasure. Tell me
Yes.
where everyone can find you.
Yes, you guys can find us skindeepsculpting.com, on Instagram at Skin Deep Sculpting, on TikTok at Skin Deep Sculpting, on LinkedIn at Skin Deep Sculpting. And we're in the Heights, 4711 Eli Street, so you can stop by and visit us. Yeah.
Wonderful. Again, thank you so much for being
Yes,
here.
thank you for
For my
having me.
Glow Time gang, thank you for listening. Thank you for subscribing. Don't forget to like, share, subscribe. If you haven't already, follow us. We're on all platforms. All right. See you later.
Bye.